Hi, my name is Crystal Ferrone, and this is the video presentation for my Health Services Administration Capstone project. This project is for my bachelor's degree, which I receive in 3 days, and the title for my project is Improving Access to Mental Health Services. I chose this project from personal experience. I lost a friend to mental illness, and I have a family member currently suffering from mental illness. And after speaking with them, I found that they experience more barriers to getting mental health services than the actual amount of services available to them. And I wanted to learn some more. So I did a little bit of research and found out that currently in America there are over 43 million people suffering from a form of mental illness. Mental illnesses can be either depression, anxiety, bipolar disorders, behavioral disorders, psychosis, and so on. And I found out that almost 50% of everyone receiving treatment do not seek treatment at all or stop treatment. And the reason for this is there are some factors that play into why there's just not enough value perceived in treatment. Costs are related. Insurance costs are high. Out-of-pocket expenses for mental health care is high. Attitudes and stigmas towards the type of treatment and towards the mental illness itself, they're viewed as trouble to society, crazy, which is not the case, and really force people to keep their symptoms on the inside than seeking help, and then those who want to seek help have a hard time seeking help anyways. So as a health services administrator, my job is to make sure that my organization is functioning properly, expand my organization, and meet the needs of my community. And while doing this research, I didn't see much of any of that being done. It'll take a health service administrator to work with the community, work with physicians, work with nurses, and work with those suffering from mental illness to have a meeting of the minds and find ways to cater services to them. Every illness is different. Every severity of illness is different. Every individual is different. So one type of treatment is not going to help everybody. So it'll really take a lot of collaboration and a lot of time and a lot of research to figure out what can we do. And that was the big basis of my topic was, as a health service administrator, what can I do? And I found that I will need to seriously work with everyone to develop new programs and services, and not just within my organization, within the community as well. Those suffering from mental illness, they need support. They need a lifeline. They need help, and it's not a standard 9-to-5 illness where, oh, I'll schedule an appointment with my doctor and get help. Sometimes they need immediate help, and I found that technology plays a big role into that, where telehealth can be used to have a meeting with your professional and get help when you need it, as you need it. And to me, that's what those suffering from mental illness need. They need someone to listen. They need someone to be compassionate, and they need someone who really can help them. And I feel that in the United States, this isn't happening at a fast enough rate. Yes, there are programs out there. There are simply just not enough. And I really do think that we can make a difference and put a dent into the rate of suicide. The suicide rate of mental illness is so concerning and so saddening that suicide is the second leading cause of death in children. 22 veterans a day kill themselves. Seniors are 3 times more likely to commit suicide than adults. And to me, limiting access to mental health services is contributing to that number. And we really do need to work together, and I will work together and make sure that we are catering to those and meeting the needs of the community and helping as many people as possible I'm so glad I chose this topic because it really does motivate me to want to do all of those things. And I just hope that everyone suffering from mental illness can get the help that they want and the help that they deserve. Thank you very much for watching this video. Goodbye.